Hello, everybody. This is Kirby Kruger, and I'm the section chief with the North Dakota Department of Health's Disease Control and Forensic Pathology section. And I just want to welcome all of you to this morning to this media availability. I appreciate you taking the time from your busy days to be here today. Today, I want to just go over a few things concerning the Omicron variant. And so from my perspective, um, what I want to do today is talk a little bit about this variant, give some background information, talk about the World Health Organization's classification, talk about measures that we can do to reduce spread of the variant and COVID virus in general. I also want to talk about how we conduct surveillance for variants in North Dakota as well. Today with me is Molly Howell, and Molly will be available for questions as we get to that part of the presentation. But I will just give you the quick overview of Omicron, and then we can get into a question and answer session. So. Just a little bit of an update. Today in North Dakota, we reported 691 new cases. That brings our active cases up to 3,180 active cases, and our total cases since March of 2020 of 162,976. This morning, there were 165 people reported to be hospitalized due to COVID. Last week, the World Health Organization announced a new variant that emerged out of Southern Africa, and the World Health Organization classified the new variant as B.1.1.529 as a variant of concern, and they named it Omicron. On November 30th, just yesterday, the U.S. government's SARS-CoV-2 group named Omicron as a variant of concern here in the United States. The reason why they did that is because this particular variant has now been detected in multiple countries because of the transmission that is occurring in Southern Africa and South Africa, and the displacement of the Delta variant by this particular variant in South Africa. Mutations in the virus, and the other thing that they quoted was the mutations of the virus that could indicate a reduction in the effectiveness of monoclonal antibody therapy. Right now, that means that this particular variant, Omicron variant, has been added to with Delta as variants of concern, and those are the two variants of concern now in the United States. Omicron was first identified in Southern Africa, and the earliest specimen that I've been able to identify through my searches where Omicron was detected was actually collected back on November 11th. The variant has gotten a lot of interest from the public health and science community because of the numerous mutations that have been found on its spike protein. And so having mutations is what this is all about. You know, the SARS-CoV-2 virus mutates frequently, but what is concerning about this particular one is the number of mutations on the spike protein, with at least 32 that have been identified. And just as an example, Delta on that the spike protein for the Delta variant, there's been at least nine mutations identified there. So it's quite an increase in the number of mutations on the spike protein. And that's significant is because the spike protein is sort of the key on the virus that allows it to enter human cells and cause infection. And so that's why that becomes significant. To date, the variant has not been found in North Dakota, and it has not been found in the United States. But the variant has been found on 6 continents in at least 23 countries from what I can see, including many European countries and Canada. The World Health Organization has classified this variant as a variant of concern because the virus has genetic changes that are suspected to impact virus characteristics of interest. So its infectivity and how contagious it is and those types of things. The variant has been demonstrated to be associated with one or more of the following changes. Increases in transmissibility are a negative change in COVID-19 epidemiology, or increases in virulence or a change in clinical disease, or a decrease in effectiveness of public health measures in available diagnostics, vaccines, and therapeutics. To say the least, we have a lot to learn about this variant. It is just newly emerged and newly recognized. We do not fully understand how infectious this variant is compared to other variants, how well a previous infection with a different variant will protect against infection with this variant, how well a vaccine will protect against infection, severe disease, or death, how well current diagnostic tests will perform in detecting the virus, although the early information is that the current diagnostic tests are detecting this particular virus, and how well monoclonal antibody therapies will continue to work in preventing severe illness and death. So we have a lot to learn, and as this variant continues to emerge and public health and healthcare officials throughout the world continue to study this, there's certainly going to be more information evolving and emerging as we learn more about this in the coming weeks. So I think the good news in some of this is that the things that we have been doing all along to help prevent the spread of the COVID-19 virus, SARS-CoV-2, are still important today and still are going to help us to reduce the spread of Omicron if Omicron becomes present in our area. The first thing I would mention is get vaccinated. Vaccination is still the best tool we have to reduce the risk of infection and severe disease. I think that, and the other part of this is for individuals who have started their vaccination series or have completed their vaccination series, the CDC has now recommended booster doses for all adults. And if you were vaccinated with the Pfizer or the Moderna vaccine, that booster dose can be given 6 months after the last dose. If you were vaccinated with the Johnson & Johnson vaccine, that booster dose can be given 2 months after the initial dose. But people can also further reduce their risk in addition to vaccination by doing things such as social distancing, masking, avoiding crowds. And so these are things that we've been talking about since March of February of 2020, so these aren't new things. I just want to talk a little bit about how we conduct our surveillance for variants in North Dakota. First of all, we have the privilege of working with a very great laboratory. Our laboratory services section does the testing for us in North Dakota for the variants. And what happens is our laboratory will take specimens that have tested positive by PCR, and they will randomly select some of those specimens to be further analyzed to be variants. Now, the diagnostic testing, such as the PCR testing and the rapid antigen testing, that tells us that an individual has an infection and has the SARS-CoV-2 virus present. It doesn't tell us which variant it is, and those tests aren't designed to do that and aren't capable of doing that. So for those specimens that test positive by PCR, our lab will randomly select specimens, or we'll select specimens based on hospitalization, or if they're a breakthrough case, or if there's an epi link that we want to try to look at. Those specimens then go through a process called whole genome sequencing. So we have a PCR positive specimen. It goes into a process called whole genome sequencing. That whole genome sequencing, what happens is that the RNA, the genetic material in the COVID virus, then gets documented. Okay, so they actually take a look at how the the RNA is arranged in the different bases, how they are arranged in the RNA. So when that happens and that is successful, then that data on that specimen, that RNA data on that specimen gets submitted into a system where the lineage can be determined. And so the data from that specimen then gets analyzed against known specimens or known data, and then a lineage is assigned to that particular specimen. And that lineage is usually given a number such as B117 or B1351. You've heard some of these before. And then at that point in time, once the lineage is assigned, then it can be assigned to the group according to the World Health Organization's naming process. For example, Delta or Alpha or whatever the group it may be. So the process that is put into place to determine the variants works for all of the variants. We don't have to develop a new process because the new variant has emerged. What the important piece of this is that the whole genome sequencing can occur. That process is the same for the SARS-CoV-2 virus, whether it doesn't matter what type of variant it is. But once that whole genome sequencing is done, then that data, that sequence can be actually analyzed and then assigned to a lineage. So our laboratory services section can run about 400 to 480 whole genome sequence samples per week. And then so this is, right now with our caseload, that's approximately 5 to 10%, depending on the week of the total number of PCR positives. So that's a fairly nice sample, and we try hard to do a random sample of the samples that do come into us, and so that we get somewhat of a representative sampling of the whole genome sequencing that's going on and understanding what's happening in the state. Since the week of beginning August 8th, Delta has been the only variant of concern that's been reported through our surveillance system. So that was a little bit about Omicron and surveillance in North Dakota. I'm open to questions, and I'm seeing some questions so no questions right now. And Molly's available for questions if there are questions about vaccinations. So. Oh. Okay, so I got a question from Melanie Griffith. It's asking, will the North Dakota Department of Health increase its surveillance to detect the Omicron variant, and has the federal government directed the states to perform genomic sequencing on additional positive PCR tests each week? So the ability, and right now we are performing a greater percentage of variant sequencing than what's happening in the United States as a whole. But our ability to sequence more is really based on the resources that are available to us, the limitations of our instrumentation and our staffing. And so we are comfortable that what we are doing and the percentage of positive PCR tests that we are able to sequence each week is a fairly good sample. Like I said, it ranges from 5 to 10% depending on the week. So I think the important part of this is that we continue to do it, and we continue to do it consistently. In addition to the sequencing that we do right in the state of North Dakota, our laboratory does randomly select a small number of specimens to go down to CDC every week, and that's somewhere between 17 and 20 specimens per week get sent down to CDC as well, and they continue to do some of the sequencing there as well. So.
Kirby, we do have a couple of other questions. Would you like me to read them to you?
Yeah, because I'm not seeing them. Maybe I'm missing something here. So
You need to click on the published.
oh, that's why. Okay. Okay. Thank you. Thanks for teaching me something new. Okay. So from Blake Nicholson, we haven't seen a big increase in vaccination rates in North Dakota and amid Delta. Do you think the alarm caused by Omicron might push more North Dakotans to get vaccinated and perhaps result in more significant increases in vaccination rates? I think that's a very good question. I think there's lots of good reasons to be vaccinated against COVID-19. First of all, vaccination protects yourself from, with the Delta variant, it protects you from infection, and it protects you from hospitalization and death. I think the biggest benefit we are seeing is really with the more severe disease with the vaccination. And even though we don't fully understand what Omicron may bring, we do understand that being vaccinated helps to protect people, and it's likely that it's going to provide some protection against Omicron as well. To what level, we'll have to wait and see. So we are encouraging people to be vaccinated. We are hoping that we're not trying to scare people into vaccination, but if people are motivated by the emergence of yet another new variant, we would encourage them to seek vaccination. There's lots of vaccines available. So, Michael Anthony from KFR TV, we've seen other states declare state of emergencies in preparation for the variant. Do you suspect North Dakota could make a state of emergency if Omicron appears in the United States? I think we'll have to wait and see. I think it's too soon to know exactly how this is going to behave, whether it can really outcompete Delta or not. I think we just have a whole lot to learn, and to me, I would just be speculating at this point in time, and I really don't want to do that. So, are there other questions? All right, I'm not seeing any other questions. Again, just a big thank you for taking your time today to be with us. The media, and for the people of the media, your time and you're with us is important to us. And just a reminder that a recording of this event will be available to download from our video server at edtech@nd.gov if you need access, and so it will be available later on as well. And again, a big thank you, and a thank you to Molly for your help, and to Paul and Clint behind the scenes for organizing this and teaching me a few new things in the process. So appreciate it.